Yeah, we're streamed, aren't we? Yeah. Right, I think we'll make a start as the time is 10:31. So thank you very much for being here today. I think we are well beyond quorum, so that's great. I'd like to begin by welcoming everyone to this extraordinary meeting of the joint Cambridgeshire and Peterborough Health and Wellbeing Board and Integrated Care Partnership here at Newshire Hall. Filming and photography are allowed at this meeting, so please feel free to take pictures and tweet during the meeting. Can I ask, though, that everyone present please turn their mobile phones to silent or vibrate while the meeting is taking place. Please be aware that this meeting is now being live streamed and that a recording of the meeting will be available to view on the County Council's website. There is no fire alarm test scheduled for today, so if the alarm sounds, please leave by the nearest marked fire exit and assemble in the car park. The closest fire escape is through the middle doors on my left, past the WCs and the kitchen. Just to add that, the reason for this extraordinary meeting is to meet our statutory obligation to adopt or submit the Joint Health and Wellbeing Integrated Care Strategy 2022 to 2030. So this will be a shorter meeting than usual with that focused piece of work for us. We had a very productive informal development session back in October, and I think there was a very clear consensus that we should combine our formal business with opportunities to discuss and explore our challenges and our work, in a less formal setting. So we will be doing that again, an informal development session on the 20th of January. Finally, as you know, with my fellow co-chair, John O'Brien from the ICS and Councillor John Howard, who unfortunately isn't able to be here today from Peterborough, we are taking it in turn to chair this meeting, and today's my turn. For item 1, please, could the Head of Governance and Data Protection Officer report any apologies for absence?
Thank you, Chair. We've had apologies from Councillor John Howard, Jyoti Attry, Liz Watts, Stuart Francis, Nick Johnson, Darryl Preston with Jim Haylett attending as a substitute for him, Piers Ricketts, Dr. Mike Moore, Professor John Walwalk, Julie Spence, and there's Mary L for joining on the video link.
Thank you. Does any member wish to declare a disclosable pecuniary interest or non-statutory disclosable interest? No. Okay. Thank you. We're now being asked to approve the minutes of the Cambridgeshire and Peterborough Health and Wellbeing Board Integrated Care Partnership on the 14th of October as an accurate record. If any board member wants to raise a question on the accuracy of the minutes only, can they please do so now? Okay, I see no objection, so we will take that as carried unanimously. The next item on the agenda is Let's Talk, your Health and Care Campaign report. We have received 2 documents on this subject, which we'll be reviewing. Kit, are you going to be presenting this? Okay, we'll to Kit Connick from the ICS. Thank you.
Thank you, Chair. My name is Kit Connick and I'm the Chief Officer of Strategy and Partnerships for Cambridgeshire and Peterborough Integrated Care System, and I'm delighted to introduce this report. So Let's Talk campaign is about the way in which we've engaged around the development of the strategy that we have all collaborated on and bring to the committee today. We have Laura Halstead, who will come and give an update on the detailed outcomes of the report and the findings, but I just want to give a brief summary. So initially, the engagement work was in 2 phases. The first phase was to engage in those 4 priority areas that we discussed and socialised with the key groups around the system to gather feedback and ensure there was agreement that they were the right approach and the right areas of focus. Following that, we had the public and communities engagement campaign that took place between the 7th of October and the 10th of November, that really brought the people and community strategy into life, and the commitment we've made around engaging with our population in the way that we've undertaken that work. And what you'll find in the report from Laura that's also fed into the final integrated care strategy are the insights from our population. And they're split into two areas. Firstly, on the here and now, what matters to people, and also what matters to them in the future. We've had a good response, over 2,300 people online and in hard copies, and we've co-developed that campaign with Healthwatch, our partners. So the two things I want to make clear is that this is the start of our conversation. It's the start of our work as an integrated care system, and we want to respond to the needs of our population in both the strategy itself and also the delivery of that through the action plan that we'll come on to later today. So I'll pass over to Laura now to be able to give the detailed feedback of that campaign.
So if we just get some presentation mode, Kit's covered some of the headlines with you on it. So Let's Talk was our engagement campaign to really understand how people access the health and care services at the moment and what the needs, their local needs are, to understand more of how the cost of living increase could be impacting upon their health and well-being and what additional support they could need over the coming months. And also look into the future of how we could help support them to improve their health and well-being, and what support they needed from us and from others to enable them to make those changes. So what people have told us, access to health and care services, I don't think any of us will be particularly surprised to say that people are now happy to have telephone appointments more so than they ever have been before. 65% of people would be happy to have a telephone appointment or video call, but 94% are still saying that they would prefer to have these appointments in person. When we look at the cost of living impacts, 46% of people said they were already feeling an impact on their health or well-being. And actually, when we spoke to people face to face, we found that people might have said no to that question, but actually they were still worried about it. They were still concerned about when they were turning the heating on and the choices they were making about the food they were buying. So I don't think this is as clear cut as a straight no if people didn't say yes to this question. We also asked people how they felt, what their needs would be over the coming months with the increased cost of living, what support they would be looking for. And nearly half of those who said they would be seeking support said they would be looking for mental health support, followed by financial support. And then also talking to people like the Citizens Advice Bureau, 30% of people talking about things like council tax and housing support. How can they manage their money? How can they manage the pressures on them over the coming months? And 22% of respondents said they would make use of heat hubs, which, given they are a relatively new addition to our area, I thought was quite an interesting statistic. Hopefully shows that we are doing well at sharing that information with people, that there is the opportunity available. So we wanted to ask some basic questions about how people access their health and care appointments. The vast majority of people said that they would travel by their own car or be transported there by friends or family, with smaller percentages saying they would walk, go by bike or use public transport. This just helps us when we're looking at mapping out where our services are in the future and how people would get there. We then asked them how far they'd be prepared to travel to access their health and care appointments. And you'll see that the more specialist the advice and service, the further that they will be prepared to travel. So, for example, for specialist appointments or an operational procedure, a lot of people would be prepared to travel an hour or more. So more than 65% of people for the specialist appointment, and then kind of more than 70% for an operational procedure. But when they're looking at pharmacies or GPs, they'd much prefer them to be far closer to home, say 15 minutes away ideally, or if they're attending a day service or support group, people would be willing to travel up to half an hour. So I think that's really interesting to see. The more specialist you get, the more people would be prepared to travel. We touched on this earlier. 927 people left a comment to this question when we asked about how the increase of living expenses was impacting on their health and well-being, and it gave us some really rich insights into the kind of support people are going to need over the coming months. And as we touched on before, mental health was the highest scoring level of support that people would be looking for. When we asked people what things they need to manage their current health and care needs, they told us that continuity of care and the ability to build trust with the people that are providing that health and care support is really important to them. And others flagged that they may have difficulties accessing information online or by phone. And some people flagged that sometimes the telephone appointments don't work depending on the nature of the work they've got. So I think this really reflects the diversity of people that we've spoken to, and that there isn't a one-size-fits-all approach when we're looking at offering services there. However, people do like the opportunity to book health appointments online, and they do welcome a lot of those digital progress that we're putting in place. So when we asked people if they felt if they had the help and support that they needed to make changes to their lifestyle that could improve their health and well-being, you'll see the majority of people, just over half, said that they did. But there's nearly 20% of people that said that they didn't, and more than 20% that said they weren't sure. People told us that motivation, cost, and access were key barriers to them making lifestyle changes, and that these were highlighted in the winter months because they felt less motivated to go outside in the cold, quite frankly, to go on a run or on a walk. They felt that gyms might be a bit expensive for them at the moment, and that these were things that were holding them back from making those changes. So when we're looking at headline key themes, NHS dentistry did come out, but also when we're looking beyond healthcare, improved childcare and flexible childcare was seen as a key way of improving the health and care of children, and also the ability of parents to be able to access employment. There was a lot of people that flagged the importance of remembering that parents are experts when it comes to their children, that gut feeling that something's not right, that they know that their child needs some extra support, and that we need to remember that when we're having those conversations with parents. People flagged the loss of Sure Start centres that parents felt was a loss of community support for them, came out as a key message, as did the importance of services working together. They felt that the changes that they were seeing with the new integrated care system was a positive step forward, but there was still a lot of separate places to go when they needed to package together the health and care support that their family may need. When they talked about GP practices, they flagged patients being seen face-to-face, getting appointments, trying to get through on telephony systems, and the concern that some areas provision doesn't match the level of housing that's being built. There were also some concerns around digital exclusion for those that aren't able to access the online services. And of course, affordability and cost of living was flagged as another key issue. Don't worry, this is the last slide of this, so we're cantering through a lot of insights here. Workforce shortages was flagged by members of the public as a concern for them. I think they were aware of the challenges there can be in some areas for recruitment. Waiting times following the pandemic, and a lack of communication as to how long they may have to wait or why, and people turning to private solutions if they were able to. And there was concerns about social isolations from both men and women in different ages and different groups, but particularly those that may have learning disabilities or mental health concerns. They had worries that the cost of living could impact that further, that they could become invisible, feel less included, and the impact that loneliness could have on their health and well-being. And the final three things that were raised were improving access across all services, particularly GP practices and mental health support at an early stage before crisis care was needed. Mental health support, again, was flagged as a key standalone issue for people. They wanted to be able to have quick and easy access to services at an early stage, and not long wait times to be assessed or to wait to crisis point was there. And public transport, the consideration of those wider impacts that changes to bus routes or lack of buses and public transport could have for people, and that particularly be detrimental for the health and care of adults and young people. So I hope you'll agree that that was a very kind of wide-ranging and quick dive into the insights that we've got, but it's really helped shape our thinking around the health and wellbeing integrated care strategy. We will be using this as a baseline for our work in the future and creating an insight bank that we're sharing with partners, so that we can look at what the current views are of local people before we start to progress future work. But we will also be continuing this conversation because it's important we don't just have it once. Thank you.
Thank you very much. Members, do you have any questions or feedback for Laura or Kit?
Okay, thank you, Chairman. So I think, firstly, it's really important this process has been undertaken, and I really welcome the feedback. I think it's crucial. I think it's really positive also to see the breadth of engagement that's been undertaken, the range of groups, and in particular, I note the traveller and Roma Gypsy community has been engaged with. Unless I overlooked it, Laura, there was no reference to our migrant populations across Cambridgeshire and Peterborough. I just wondered if you could say a little bit more about the extent to which this process engaged with that grouping.
So for that group in particular, we were working with our voluntary community and social enterprise colleagues to try and ensure that we heard those views and those voices. Where we had a lower uptake rate in particular areas as well, we then had conversations with local groups to see if we could understand those views better. I think there's always more work that we can do in talking to these communities, but we're always very aware that the migrant community can have particular access needs. And so we did particularly reach out to the voluntary sector in that area to try and hear what they were hearing as insights. So sometimes we go through a proxy and sometimes we go direct, but certainly something we've been very mindful of in this consultation to try and get that diversity of voice.
Councillor Howitt.
Good morning, everyone. There was a danger no one would speak there, which is why I put my hand up. But you got it ahead of me. But I think it's important to say that this is obviously a huge amount of work that's been done, a very important piece of work that should guide us. Thank you very much for everyone that's involved in that. That's the first thing to say. And if we weren't doing stuff like this, people would be crying out and saying, why not? So we have done, so that's really good. The second thing is there are a few surprises in this report, though, I think for us. You know, the biggest yeses I read were people are fed up with waiting lists. People would like to book more. But of course, that plays to a particular part of the demographic who are able to book more. And we need to be cognizant of that. The mental health is the biggest issue for people. I think that's a really important finding, and that there's a lack of affordable childcare that people need. All of those things can be said to be the bleeding obvious. But it is the very fact that the things we know anecdotally have been backed up in this work, I think is seriously very important. I think there's a tension for us between people just wanting more appointments, booking them better and get them through the system better, and our aims for more prevention, where I think there's more mixed responses from people and the challenges are more complex. But I think those are the things that we have to wrestle with here, but also to be honest with the public about of what we're trying to do here, not just say we're doing what you've told us in the survey, but for this to be part of a dialogue. And that's probably my last point. It's very good, the last bit in the report, which says this isn't a one-off and we're going away and now providing health to you, but this is part of a constant dialogue in which people participate in their own health, is a really important message and probably the most important part of this report. Thank you very much.
Laura, did you want to respond? Thanks.
To say thank you, and you're absolutely right. The most important thing is that we continue the conversation on and have those honest conversations about the roles that we can all play in trying to look after our health and well-being.
Thanks. I then have on the list Mary Elford, who's joining us online.
Hello, everyone. Apologies that I can't be with you today, but I'm chair of Cambridgeshire Community Health Services. And as Richard says, I mean, you know, there'd be something wrong if there were surprises in this report, but, you know, nonetheless, I think it is a very powerful report, and I really commend the authors for the work that they have done with it. I think it captures the key points really well. I guess the point that rather jumped out at me was the point around childcare, we know that this is an issue for our staff, whether they're working in health services, local authorities, or social care. And I thought it quite interesting that this has also come up from the work with the patient and carer focus groups. I suppose I'm just thinking, what might we do with that challenge that they have given us? Because we hear just the same from our teams on the ground, particularly those who are working less conventional hours, and it's the school holiday cover, it's the whole package. And I guess I just think we need to be perhaps focused on what we might look at as a way forward to meet that challenge, given our buying power as collective organisations.
Laura, over to you.
I'm not sure I have the golden answer on that one just yet, but
an unfair one for you, Laura. I think perhaps it is more one for us as a board.
I was going to say, I think it's a challenge for us in how we consider it. And there's certainly some of us that have lived experiences of those challenges that we can bring into the mix as well.
Thanks, of course. And I know we've got a couple of other speakers who may wish to come in on some of these points. We'll take you in order if that's okay. Steve Barnett, and then Jan Thomas. Thanks.
Thank you very much. Steve Barnett, Chairman of North West Anglia Trust. I would just endorse the comments of previous speakers in terms of the content and messages going out of this important piece of work. I do wonder, though, whether in trying to create one door through which citizens are going to access integrated and joined up services, whether we need to recognise that that door might need to look a little bit different depending on which part of our geography we're talking about. So, for South Cambridgeshire, it might be different to the Fenlands, might be different to inner city Peterborough, and I think that needs to be picked up. And my second point is whether anything came out of this piece of research that requires us to help citizens with signposting more than we're doing at the moment. So if I just use health as an example, there is this folklore, whether it's real or otherwise, that it's impossible to get in front of a GP for an appointment. The dropout rates of calls to 111 in some areas are 60%. So these are people who are hanging up before the phone is answered. And if they're still feeling poorly, they're making their way to A&E units where there is tremendous pressure now already. So that's my question, really, whether anything was coming out of respondents about making it more straightforward and understandable for people to know what to access and when, and if it's going to be a single door, how we're going to pick that up and build that into the work that we're going to do as a group of partners. Thank you.
Sorry, thank you. Shall we move to the next question and then maybe we can round these things together? Thanks.
So I think it is worth us at some point, I'm not sure it's here, but picking up about the current pressures and what we are going to be, what we are doing about it. Because obviously I think what this report shows is that it is really difficult for people to get access services. And I don't think that's personal against any one of the services that people are trying to access. I think there is a rising tide of frustration that previously people would have been able to pick up a telephone and have a conversation, and now they feel like they can't. And I don't think that's any different across any sector. So I think we need to be careful how we don't make this all just about GPs, because I think actually that there's a lot of them doing some fantastic work out there for GPs. So I think that's the first point I'd make. So I guess my question, Laura, was going to be, so we did a survey very similar to this. I'm trying to remember how many years ago, 3 or 4 years. And I'm just wondering, what changes have we seen? Because given some of the challenges we have now, we would expect it to be quite different. And I'm just wondering, is it as different? Is it as different as we think it is?
So yeah, the big conversation was just pre-pandemic. So we started it 3.5 years ago. I think we did ask some different questions in it, but the main shift that we've seen between it is people really being more open to different solutions than they were before. I think there is definitely much more of an acceptance and acknowledgement of the role that digital solutions can provide. I also think there is a higher level of anxiety generally around their health and well-being than we saw before. I think when people are talking to us, they have a far greater awareness of their health and well-being after the pandemic, how that has impacted them, and actually what support matters to them most. I don't think we've seen the shift in people being intrinsically motivated to change their health and well-being that we might have hoped to have seen after the pandemic, knowing how those influences could have really impacted them during that time. We haven't seen as big a shift on that. I think it's more an openness to the digital services, a greater awareness of the pressures that we're under, and actually the ability to have a wider conversation about all of the things that impact their health and well-being, because this is far broader than our last conversation.
I have a question from James Morrow, and Lynn, are you raising your hand as well? And I'll come in after that. Thanks.
Thank you, Chair, and thank you, Laura, for the report, which is a treasure trove of informational nuggets and a lot about the experience of those using or trying to use or not being able to access services. And I suppose the point I really wanted to make is that the experience of the users reflects a mismatch between demand for services and the ability to provide it. And I think it's important that we distinguish between those two and understand that actually a large part of the current and expressed frustrations, rightly expressed frustrations, is about a lack of resource within the system to meet the reasonable expectations of our citizens. And just to, I suppose, put it in context, as a GP, our practice yesterday received 1,525 incoming patient phone calls, which is one every 23.6 seconds throughout the day. And we returned almost all of those calls on the same day. That some 48% of people who contact GPs at the moment within Cambridgeshire and Peterborough are seen on the same day that they make contact. And I've been a full-time GP for 28 years. And with absolute honesty, I can say that we have never been working harder, never been seeing more patients, and never struggling more with onward access within the system than we are at present. So I think that it's important just to set the context that we need to think not only about the experience of the users, which is ultimately what we're trying to get right. We also need to understand we need to get the provision aspect right to be able to deliver that. And this report, I think, is a very powerful and important statement about the need to focus on the provision side of things to improve the experience. Thank you.
Thank you, James. I think we'll go next directly to Lynn, and I'll add my comment and then we can round up so we stick to time. Thanks.
Thank you, Chair. I thought it was extremely interesting, and I thought there were one or two surprises in there. There were for me anyway, put it that way. And I think it's so important to get these figures and have the comparison, which we've talked about. Somebody else has talked about having a comparison from before, but equally, so when are you going to do it again is one of my questions, because I think it's so important, but you're trying to hit a lot of people, aren't you? And across the entire county. And I just wondered as well, my next question was really about the ethnic groups, because we have a lot of ethnic groups in Peterborough, and they're in particular places and particular postcodes as well. And so I wondered whether you actually found that many people there responded to you. Because if they did, I'm delighted. And I wondered how you got to that. So the ethnic side, and the other thing that really didn't surprise me in the slightest, but I was quite pleased to see, since I have children's services and education and all those, the sort of learning things in Peterborough as my portfolio, is that children are very important to everybody and they sort of come out tops. Probably that shouldn't surprise anybody, but certainly when I was a child, that was quite a long time ago now, that wasn't the feeling that you got, I think. And so I think there's been a change in how people are viewing their lives. Now, whether that's to do with the pandemic or whether it's been coming on for a long time, I don't know. But I just thought that, you know, since one of our major priorities is children, which I was always delighted to see, I think that's terribly important, and we need to keep tracking that. I could give you another surprise, another thing I could ask you. I don't know whether you want to answer those little bits I've given you so far. Well, the other one that I thought was, because I've got two sons, and one's in his 40s and one's in his 30s, and they're completely different when it comes to thinking whether they're going to see the GP or not. Completely different. The eldest one never wants to do it. I mean, he dropped an iron bar on his foot the other day and refused to go and see anybody about it until I got quite cross. That's the one in his 40s. The one in his 30s will go at the drop of a hat. Now, the difference, I think, probably is that he comes within this 25 to 44 age group where they were brought up more on social media from an early time. And I think that that's the ability to talk about your ill health for men has always been difficult. And it certainly was with my father and my uncles and everybody like that, is all I can tell you. They rarely spoke about their health. But now the young people are more prepared to do so. And I just think that also needs watching, because we need to try and do something about my eldest son, for example, and other people's sons of 40s and 50s who just won't go and do what they should do. And then it gets to be too late. So anyway, lots of things that I thought came out of this, and I was very delighted to read it.
Thank you, Lynn. I think I'll just insert my couple of comments and then we'll aim to round up. Following on very much from what you've just said, my 2 points are about the response from young people to this piece of work, which was noticeably low, and what we might do, as this is a living piece of work. And Lynn did ask very rightly, what's the next conversation and how we might improve that engagement. I'm sure there are lots of reasons why, but we don't have all the social media platforms that younger people might be using. And my second comment really is the notable point around transport and access. I mean, access is access not just to health and care, but in everyday life. And that must play a huge role in all the things that count as prevention in lives. So I just wanted to highlight that. So I'll hand over to Laura and or Kit to finish up. Thanks.
So the only thing I want to say is that thank you to Laura and the team. It's been a huge effort to gather this feedback, and thank you to the people and population who've really come forward and giving this feedback. I think the key message for me is that this is the start of the conversation, and that what we want to signal as this work is ongoing. And only last week I had a conversation with Sandy Smith from Health Watch around data that Citizens Advice Bureau and Health Watch are gathering in addition to this, and that we will layer on the Let's Talk feedback. So we're getting a lot of rich data which will inform some of the work going forward. So thank you to everybody.
Excellent. Thank you very much. And thank you, Laura, for your presentation, and to the team for all the hard work. Okay, right. We will note the findings of Let's Talk, and we move next to item 4 on the agenda, which is the Health and Wellbeing Integrated Care Strategy. Jyoti Tree, our Director of Public Health, is unfortunately absent today, but Kit is here. So Kit, may I ask you to present the report? Thank you.
Thank you. Yes, so Jyoti isn't here, but I need to impress that this is a joint collaboration between mine and Jyoti's teams, and many of those colleagues are here, will obviously join the update as well. So I'm delighted to introduce our first integrated care strategy that's been a collaboration across all system partners, and that we're in a position today to be able to share with this committee to be able to prove it, hopefully by close of play of the meeting. So there are some requirements which I'll come on to the end, but what I want to just give an update in terms of what we've got in front of you and how this has come to being. So this work started last year in early 2021 around coming together around our collective ambitions and our common purpose of what we want to do together to improve the outcomes for our population. We have a clear narrative around our why, around the demands and needs of our population, and we've heard some of that already in the Let's Talk campaign and feedback, and of course the work that Louis Camphor's team are doing around the insights pack around some of the challenges for our population now and in the future. We've got a clear way forward in terms of our how. We have a single ambition and a single vision we have committed to. We've got 3 health and wellbeing areas of focus, and we've got 4 strategic priorities that have been set out and are agreed across all organisations across our system. And then finally, our what, the enablers that we have within our respective organisations and across the system that are going to help really make the changes we want to see. So the feedback from our people and communities and our staff and our organisations, and many of us around this table, have not only fed into the content of the strategy and have informed that and some of those outcomes, but also you'll hear people's spoken voice in that strategy document you'll see in front of you, and you'll hear their personal quotes, their personal perceptions, and some of their personal contributions to how they feel about the health and care they are receiving now, and their concerns around the future. What we have articulated in the report are some measurable changes and deliverables for each of those strategic priorities we've set out. And there's a further session on the 20th of January where we'll start to really work those up. So we translate strategy into delivery, and we make this not only a shiny document that is engaging, but also forms a coherent plan that we can all work to. So I will ask some of the public health leads to be ready to, in Jyoti's absence, to answer any questions around those particular areas, and they'll be able to give a brief update. But just prior to that, I'll just run through quickly the housekeeping governance. So this document is the full version, it's comprehensive, it's engaging, and it will be published on our website following this meeting. It's currently there in draft. We also have a shortened version that's easy access, that will be 10 pages, and all those documents will be accessibility read. We do need to finalise today whether we are comfortable as a committee to approve this document, and therefore after that it will be shared formally by the governance team across the ICS with all partners and the local authorities and the Integrated Care Board, so that due regard can be taken into account when delivering the joint forward plan and also delivering its content. And then finally to say that the priorities chapters and the evidence that's informed those has already been published on the Integrated Care System website. So there was a clear read across around our why and our purpose for delivering this strategy, and also the outcomes set out within that. So I'll pause for any questions and then just allow about the process, and then allow our public health leads to be able to give any brief update. I don't see any questions, so perhaps, oh, John.
Chair, thank you. It was more of, I guess, a sort of comment than a question, but I'll add it at this point, which is, I mean, I think it's really good to have seen that work that the system did well before we came into being as a joint forum, sort of played all the way through. So, you know, thank you to everyone who's done some of that. I'm very conscious of the fact it's really important that this will inform, you know, the Integrated Care Board and its forward planning and its strategy, and that's a sort of a requirement. But that's really important that we take forward those themes, and that we're accountable for our contribution to it. But obviously, partners around the table will have to make that contribution. I think we always said that this would be a starting point. And it's good that we've got to the end of the year and have been able to comply with what we've been asked to do in terms of developing the strategy. But I think probably quite a lot of the sort of creative discussion, which we'll start at our more informal session in January, I think is important to recognise that we've got more to go. And I think, you know, even looking at the draft we've got, you can see some of the opportunities for more integration of some of the themes as we go forward. But you know, I'm pleased that we've been able to get to this point, and we've got a platform, I think, then to develop and iterate in that way.
Did you want to carry on? Oh, no, it's just to come to the public health leads in Jyoti's absence in case they want to give a brief update on sections.
Good morning, and thanks for giving me the opportunity to present on the priority 1, which is about children entering and exiting education, prepared for the next phase of their lives. I'm Raj Lakshman, consultant in public health, lead for children and clinical policies across Cambridgeshire and Peterborough. That's enough. Thanks. So I think we all know that education and health are so intricately linked. Not only there is a direct impact on our level of education, and that results in our employment opportunities and income and our socioeconomic background, but there's also, not only is there that direct effect, but education leads to better health outcomes in terms of better health behaviors and better long-term health. So there's good studies that show that the higher the level of education, the better health outcomes in future, irrespective of income and employment. We also know that school attendance has many positive impacts, and school absenteeism is one of the key measures where we can think about how children may not be doing so well on their health and mental health, especially. So school attendance has an impact on health and education. In addition to the importance of our educational level, the education system is a place where children spend a lot of their time. It's almost like working age adults spend time in employments. Children are spending a lot of their waking hours in schools and education settings. So these provide opportunities to develop more healthy behaviors and health promotion opportunities. We do a lot through schools, whether it's the immunization programs or health promotion through a healthy diet, physical activity, and mental health, whole school approaches. So there's a lot we can do through education settings to improve the health of children. The long-term outcomes that we've chosen for this priority are increasing the number of children who show a good level of development or school readiness when they enter education, and reduce the number of children who are not in employment, education, or training when they exit, and reduce inequalities in both these outcomes. The reason these are chosen is because some of the other, and it was a great pleasure to see that children have been recognized as a priority. Childhood obesity and mental health are important, and they're picked up in the other priority. Childhood poverty is picked up in the next priority too. So this priority is looking at where we can work. We need cross-system, multi-agency working to improve outcomes. Both of these outcomes, we do need cross-system collaboration to achieve these, and they are different to the ones that are chosen in the other priorities, because we could have chosen a lot of other things for children as well. What I've presented, the data here for school readiness, it shows it's old data from 2018-19, but we expect the new data to be published shortly. It was paused, the collection of that data was paused during COVID, but we can see here that Peterborough is among the lowest in the east of England, and similarly for NEET, Peterborough was the worst. But I think things have improved, and we'll see that with our comparative data, because a lot of work has been going on to improve both these outcomes in the system. So in terms of entering education, we've got a few actions and exiting, we've got a few actions, that short-term actions that we can monitor and look at, and they're listed here. I won't go into all the details and the reasons why these have been chosen. As I said, I think some of them come from what we found in the Let's Talk survey. Some of them have come through co-production and engagement in other areas, and some have come from evidence-based. We know about, for example, the damp-free accommodation and mold in relation to childhood asthma, recently a lot in the news as well. And in terms of exiting education, again, there's a lot of work we need to do in terms of household support fund. We know about the cost, we've talked about the cost of living crisis and free school meals. And in addition to increasing the uptake, it's also about increasing the quality of school meals. We want more children to be in employment opportunities, transitions in terms of especially around children with mental health and special educational needs, and we want children to be in settings that are rated excellent or good, which will help them achieve good A levels when they exit. But those are the high level outcomes, and then the immediate short-term actions that we've proposed. And we'll deliver the delivery mechanism for both of these. So the entering education would be through the Family Hubs Transformation Program. We set up the Best Start in Life program many years ago, and we've now got funding in Peterborough to develop Family Hubs, and there's a commitment to try and replicate that across Cambridgeshire, and it's a multi-agency, multi-sector representation from early help, which is children's social care, local NHS trust, public health, early years education, and voluntary sectors partners. It's a flourishing partnership which hopes to deliver and drive through the Family Hubs Transformation Program. The NEET Strategy Board again has broad representation and will oversee the reduction in NEET, in addition to lots of the other things that are mentioned in the action plan. Happy to, I don't know if questions are at the end or you want me to take questions now.
Thank you, Raj. I'm just thinking, I think we're going to be looking at all 4 priorities, but we probably only have time to do a summary version, I think, to get through by 11:30. So perhaps we could just hear briefly from our other presenters, if that's okay, and come back with any burning questions. I know we're going to be looking at this in depth at our session on the 20th of January. Thank you.
Hello, I'm Val Thomas. I'm Deputy Director of Public Health in Cambridgeshire and obviously working across Peterborough as well. And I've been working along with others on priority 2, which is very much about how the environment shapes and influences our health. And not surprisingly, the focus is upon obesity, which is probably the biggest public health challenge that we have at the moment. Its ramifications are felt throughout the system, throughout health, social care, and so many areas. This first slide picks up on the key themes, which I think we need to focus on. And on the right-hand side is, for those of you who are familiar with the Foresight Report of 2007, which still provides a blueprint for obesity and the obesogenic environment, which very much is a term that's emerged from that report, but it shows the complexity of it essentially. And it's been highly criticized for being complex because it is complex. And I think it's a good example of where we really do need a system-wide approach and contributions from all parts of the system. It really is a good example. And we need that transformational evidence-based change. We've known since the 1990s that obesity from childhood through to adulthood has continued to increase. So what are we going to do about it? And now is a very good opportunity. So the focus is very much on the interventions that drive this obesogenic environment, but also we also know the other side of it is you might change the obesogenic environment, but it doesn't mean that people are going to respond to that environmental change. So it's understanding those behaviours. Very mindful of the increased poor health outcomes. I think that the association of diabetes, cardiovascular disease is immense. But we also know that interventions in childhood will have the greatest impact on those lifelong health outcomes. Now, let me go the right way this time. We fixed the ambitions, but they're not set in tablets of stone. I think they probably represent how challenging getting any shift in obesity is. Some of them, for instance, the physical activity ambition is a national ambition. We are working some more on these percentages because you want them to be challenging, but you want them to be realistic, given the challenges that obesity presents. So why are we concerned? This briefly looking at childhood obesity. A lot of focus started on 2006 and 2007 when we really started collecting data around childhood obesity, which became very aware. And I think the important things about those graphs is that, oh, that's good. It seems to be stable. We're below the national level. But in fact, that's the point. We've stayed. We've just traveled along. And also, if you see the effect of COVID, those sort of little peaks, which we saw played out nationally and locally, which Now we've got better data. It's not quite as high as that now, but it still shows the impact of COVID, and it really drives this this agenda along. And I think the other significant fact is that what it means is that 41% of children in Peterborough and 32% of children in year 6 are either obese or overweight. And I think if you put it in that context, that nice straight line actually means nothing, essentially. We haven't moved it at all, really, since 2006 and 2007. Oops, wrong way. Shifting forward into adult obesity, and that's where you see that childhood obesity played out. So we have basically across Cambridgeshire and Peterborough, give or take around 6% of adults are either obese or overweight. In fact, there's little variation between the districts. It's, you know, it's slightly higher in some areas, but really it's just high. There's an association with deprivation where we do see some sort of higher rates, and I think probably from national data, ethnicity and things like learning disabilities. But, you know, there's a challenge. Oh, I never get this right. So what are we going to do? I think this is about the environment, and I've made this slide kind of busy, and so don't look at all the detail, but I think on the left-hand side, the focus is very much on those environmental factors which can be influenced by policies and interventions. So, for example, we've got focusing on access to physical activity, designing the built and natural environment, active workplaces, which also picks up again on all the other priorities as well. And then on the other side, it's that behavioural understanding the behaviours, and, you know, thinking back to Laura's presentation where she, you know, some of the responses that people said, behavioural insights intelligence is about drilling down into those. So if we put in certain interventions, would we get the response that we wanted? So if we take the example for active travel, for example, I am rushing, Susan, I can see you looking at your watch. So, if you take, you know, we've done lots of active travel, but how are we going to get people really take those opportunities that active travel affords? So it's a combination of changing the environment, but also understanding if we put those changes in, how do we need to shape them? Got it right. We have a framework, and we have a whole wealth of strategies, interventions, services, which all can contribute to this. But there's still lots of things to do. I think some of those interventions need to be evaluated. We need to get behaviour insights, which is this behaviour which is quite well accepted, well evidence-based research into motivational factors. Look at those synergies across the system and how they can be used more effectively. And what we want at the end of it, you know, is a perfect strategy where we have an understanding of these influences. We have supportive environments, and we have collaboration to make sure they work and they mutually reinforce each other. But I think also one of the things perhaps very much important to be mindful at the moment is the current economic pressures, which does affect people's abilities. So, and we, that's it. And I think we have some ideas where we want to take it forward immediately as well, and started some of those, but I'm aware that I will withdraw at this time and hand over to my colleague. Oh, I'm off. Sorry, technically.
Thank you. Are we going to priority 3?
Yes.
Yeah. Great.
So I'm Emily Watkins, the Deputy Director of Public Health for Peterborough. And I am aware of the time, Susan. So this is about better housing, better skills and better employment. So we know that the issues around overcrowding and affordability have increased recently, and especially with the cost of living, it's going to get worse. The huge health impact that comes from poor quality housing is really clear, and the wider impacts of poor housing around educational achievement and economic potential. And it came through really clearly in the Let's Talk campaign, with 23% of respondents saying that their housing situation impacted their health. Looking at employment and skills, we do have inequalities across Cambridgeshire and Peterborough, with some of our towns and cities doing better than others. We do know that unemployment and low paid work is associated with poor health outcomes, and 20% of those who are economically inactive in Cambridgeshire and Peterborough are on long-term sick, and rates are increasing since the pandemic. And again, the Let's Talk Health campaign identified that 25% of respondents said that the workplace, academic stress and unemployment were preventing them from leading a healthy and happy life. A lot was the sort of response that came through. So it's clearly a huge issue. What we've done with this is looked at it, they are slightly sort of separated. We've got some really clear priorities, both on the housing side and on the employment and skills side, and detailed outcomes and action plans are being developed for each of these higher level outcomes. So things about new homes to meet health and wellbeing, quality of housing, that's especially important, the cold, the damp, the thermal conditions, those in safe and secure housing. So homelessness has a huge impact on people, and also making sure that people are mentally well in their homes. And then with employment, it links so closely with the children's side about higher skilled jobs, increased employability, and people can get skills throughout their careers, and also ensuring that long-term conditions are not a barrier to being in employment. There's a lot of cross-cutting working and themes that have been identified in that priority. I'm not going to go through them all. And then the final ambition is about reducing poverty. And what we've picked on is some of the key outcomes. So we're not anticipating this changes in the short term. This is the long-term 2030 ambition to reduce the proportion of children living in relative poverty, to reduce the proportion of working age population claiming on work benefits, and those claiming universal credit. Pass on to Cathy.
Right, I realise we've only got a couple of minutes. So Cathy Hartley, Consultant Public Health, responsible for population mental health. So obviously, it came through very strongly that mental health is a massive issue at the moment. So this priority is around promoting early intervention and prevention measures to improve mental well-being in our population. So I'll whiz through, this is just to show the increase in prevalence of depression. You can see the rise across all counties, particularly in Finland. Children, young people's mental health those being referred into services, to secondary care services. You can see the increase in recent years. This just shows you all the factors. We know the wider determinants of mental well-being affect us through our whole life, and are cross-cutting from the individual, family level, community and cultural level. And these are just some of the factors, things like income, employment, socioeconomic status, and nutrition, trauma, all sorts of aspects affect our mental well-being throughout our lives. So with this understanding, we then have also consulted, and this is part of the public mental health strategy we've been putting together. We consulted quite widely with the population, ran a survey, but also the recent findings for the health and wellbeing strategy. We identified some major themes to try and address mental wellbeing, to promote good mental wellbeing and look at prevention. That I will just literally highlight the themes. The first theme is around communication, information, and resources. People told us they still didn't know what there is available to support them with their mental well-being. So a big theme is around improving that. The second is around motivation. That came through to again in the recent Let's Talk as well. How do we improve How do we improve that motivation to people to actually do the things that they might know are good for them? And that's about bringing things to them, but also peer support, life coaching skills, community navigators as well. The third theme is around building relationships. This is something that I think we've missed before. It's around those family relationships, peer-to-peer, child to adult, improving, enriching our own social contacts, and addressing loneliness. The fourth theme is around those wider determinants, how we can use our system, the integrated care system, health and wellbeing board, etc., to look at leadership around those wider determinants and different aspects to address those. And the fifth theme is around system understanding. So looking at the whole pathway mental health system, and how we can use our data more intelligently to look at where the blocks are and enablers are within the system, particularly children and young people's mental health, to potentially shift resources where need be, to look at prevention and more upstream intervention. And that's it.
Thank you very much. I guess we all took Let's Talk very seriously, and we all talked then, which means we've run out of time to talk now. However, the purpose of today is really just to note the huge amount of work that's got us to this stage to be able to adopt this strategy so that we can begin working on it. And that's what we'll be doing in January. So with your permission, I think I'd just like to move to the recommendations. to approve the joint health and wellbeing integrated care strategy for Cambridgeshire and Peterborough, recommend that the strategy is published in accordance with national guidance. Then the third recommendation is may sound a bit mysterious. Simply note that our next meeting for the 20th of January is an informal development session for board members, and that will allow us to explore and discuss these priorities. And I think Jyoti, who's not here, will be offering very good coffee, and all the name cards will be thrown into the middle of the room. The chairs will be moved, and I don't even think we'll be meeting here. We'll be in Ely, so we're going to have new surroundings, and hopefully that will motivate us to think anew. So with that, may I ask for your approval? I see all nods. Thank you very much. So that is agreed unanimously. Finally, we have the forward agenda plan, which we've sort of talked about. And I think we will be brainstorming our action plan next month. And I think, John, are you content that we take it that way?
Yes, that's fine.
Yeah. Okay. So could I thank everyone for being here today? And thank everyone who's got us to this point. I believe we are very unusual as a health and wellbeing board integrated care partnership in having forged a common committee and even arrived at the point of being able to submit a strategy. So that's fantastic. Thank you very much, and I hope you all have a very happy Christmas. Thanks.